Hi, my name is Dr. Lori Keynes, and today I want to discuss a focused history. In the launch, you learned a comprehensive history, which is very important to perform when you're seeing a patient for the first time, either in the hospital or in an office. Oftentimes in CLIC or in your dental clinic sites, your preceptor may already know the patient and may have much of their history already. It may therefore be appropriate to do a focused history, which follows the same format but contains a different level of detail and is really focused on the concern or chief complaint the patient is coming in with today. So in summary, a focused assessment is really appropriate for established patients. It addresses focused concerns or symptoms, and it applies examination methods that are relevant to assessing the concern or problem as precisely as possible. Now you'll see me do a focused history on a patient in clinical skills. Okay. Hi, Doug. How are you doing?
You're doing that well, Doctor. Good to be here.
All right, let's see what we can do to help you out today then. What brings you to the office?
Well, ever since I started exercising, my knee has started to, get really sore. I came in kind of getting me concerned.
Okay. All right. And any other concerns today?
No.
No, just the knee?
Yes.
Okay. Can you tell me a little bit more about what's bothering you with the knee?
Yeah, well, when I saw you last, you had told me that, my blood sugar was a little bit high and I should start exercising and watching what I eat. So I started taking walks and hikes for, maybe 40 minutes every day. I've been really pretty good on that.
Great.
I did really well for about 3 weeks, and then my knee started to hurt.
Okay.
Started taking some ibuprofen, and that seemed to really help. The next week, it was a little sore when I was walking. Then, somewhere along the line, in addition to that, I found that not only was it sore when I was walking, but I went to the movies in the Hartford Stage in the same weekend and found that if I was just sitting without moving for a couple of hours, my knee got sore at that point as well.
Okay.
Next day I went back out for a walk. Everything was still pretty painful. Over last weekend, decided I would try to hike up Avon Mountain, and boy, it was really, really painful at that point.
Okay.
Clearly the worst that it's been, so I just thought at this point it's time to come in
Good.
and talk about it.
Okay, I'm glad you came in so we can figure out what's going on with your knee, get you back exercising. You gave me a lot of good information. You started exercising 7 weeks ago,
That's right.
but the knee started hurting 4 weeks ago.
That's right.
Is that correct?
Yes.
Okay. And it's been progressively getting worse in those last 4 weeks?
I would say particularly the last week, the pain itself is there. The oddity of sitting down and having it hurt was new.
Okay.
The pain has still been there those other 2 weeks, yes.
Okay. Did the pain come on all of a sudden, or was it a gradual pain?
I would say it was gradual, but it was pretty quick to where it is now. It's not like it worked itself up.
Okay.
Within just 1 week, I think it was pretty steady.
Okay. And is the pain hurting all the time, or is it hurting sometimes and not other times?
No, it's just sometimes and not others.
Okay. So sometimes the knee feels totally fine.
That's right.
Okay. So it's kind of an intermittent pain.
Yes.
Okay. What makes the pain worse? You mentioned a couple of things. The hiking really bothered you, and the sitting in the movie theater and at the Hartford Stage.
Right.
So it sounds like sitting and then like climbing are...
Yeah, I've also been running a little bit.
Okay.
On the sponge tracks, it doesn't seem to bother me quite as much as it does
Okay.
in the other situations.
Okay. So running, climbing, and sitting are all things that are bothersome to the knee.
Yeah.
Okay. Anything else make it worse?
Not really.
No. You mentioned you've been taking some ibuprofen for the pain.
Yes.
How much ibuprofen have you been taking?
Regular strength, 3 or 4 times a day.
Okay. Like 1 or 2 tablets?
Yes.
Or okay. Okay. So 1 or 2 tablets 3 or 4 times a day of the ibuprofen.
Right.
Do you find that helps?
Absolutely.
Okay. Where do you rate your pain if your pain is on a scale from 1 to 10? 10 being severe pain, 1 being pretty minimal, light pain.
Well, obviously we talked about the fact that at some points it doesn't hurt.
Right.
But when I'm walking, it's usually around a 2 or a 3.
Okay.
Over the weekend, what really pushed me to come in to see you, I would say it was maybe a 6.
Okay.
When I was doing the hiking up the hill.
Okay. So at its worst, it's a 6, and sometimes it's not there, and then when you're walking around, it's pretty minimal at a 2 or a 3.
Yes.
Okay. All right. Do any of your other joints bother you, or is it just your right knee?
No, just my knee.
Just your knee. So the hips and the ankles feel fine.
That's right.
Okay. Have you had any fevers or chills at all?
No.
No? Okay. And when you look at the knee, do you think the knee looks any different to you than it usually does?
I mean, not all the time. I mean, I have seen swelling.
Okay.
You know, and when I see that, I just go get an ice pack and put it on, and that seems to take care of the swelling.
Okay. So you have seen some swelling?
Yes.
Okay. Does the knee ever give out on you?
I don't know that I would use the word give out. I mean, sometimes it hurts more, and you don't want to put that much pain, pressure on it.
Right. Okay. But it doesn't just buckle on you. And
That's right. No.
okay. All right. Have you heard any noises coming from the knee at all?
Yeah, absolutely. I mean, when I was watching TV the other day, you know, just kind of trying to loosen it up a little bit, I noticed a pretty significant little click.
Okay.
It was new.
Okay. A little bit of clicking, and you hadn't heard that before?
That's right.
Okay. And have you had any trauma to the knee at all?
No.
No. So it just seems like this exercise is what started the whole process. Okay. So it's my fault.
Everything would have been fine.
All right. Anything else you think I should know about the knee pain at all?
No, I don't think so. I mean, obviously, if I'm here, it's obviously significant enough to me that it
Right.
is, you know, it's got me a little bit worried. I mean, I don't take ibuprofen all the time because I need it, but I mean, sometimes it's almost as if I pre-treat knowing that if I'm going to go out walking, I'll take it ahead of time.
Okay. And you don't want to have to be doing that on a regular basis. Okay. So let me just recap because you gave me a lot of good information. So you started a new exercise program about 7 weeks ago. Doing okay for the first 3 weeks, but at week 4, you noticed that you were starting to have some knee pain. Definitely noticed that it got worse when you hiked up Avon Mountain, and you noticed it then happening when you were just sitting down at the movie theater, for example. You've had some swelling. The pain came on gradually. At its worst, it's a 6. Sometimes it's not there at all. And when you're walking around, it's kind of a 2 or a 3. Ice helps the swelling. Ibuprofen helps the pain a bit. And it doesn't seem to be getting better on its own.
That's right.
Okay. And no other joints are affected. You're not feeling unwell in any other way.
That's right.
Okay. All right. So Doug, let me just ask you a couple other things. Now, I already know your medical history. Have you had any knee problems in the past that I'm not aware of?
No.
Anything specific, arthritis you've been diagnosed with, or any trauma to the knee in the past? No. Okay. Have you had any surgeries on the knee before?
No.
No. Okay. Do you take any medications at all besides the ibuprofen?
No, the ibuprofen is the only.
That's the only one. Are you allergic to anything that I'm not aware of?
I may have a little allergy to dogs and cats, but that's all.
Okay. No medications or anything like that. Okay. Any orthopedic problems run in your family at all?
No.
No. Okay. And just recap for me what you do at your job. What does your typical day look like for activity?
Well, I work in the business office of a state agency. Obviously, It's a sit-down job, but I don't sit down long enough to bring on the pain.
Okay.
The printer's out in the other room, the staff is out in the other room.
Okay.
So pretty much, you know, I'm sitting down for a significant portion of the day, but definitely up and down between breaks and lunch and everything else. I mean, I haven't had any pain sitting at work.
Okay. Okay. And are you a smoker at all?
No.
No? Okay. And have you been in the past?
No.
Okay. Do you drink any alcohol?
I mean, I'll have a beer every once in a while, but not that much.
Okay. And any recreational drug use at all?
No.
No? Okay. All right. So I think I have a good amount of information about the knee. I think the next step would be to examine the knee. And then once I do that, I think we'll have a pretty good idea of what's going on, and we can come up with a treatment plan at that point. Does that sound okay to you?
That sounds fine.
Okay, great. So let's have you sit on the table.